Okay, this is control of ventilation, part 4, and we're starting at slide 32. So looking at another diagram, we have signals that are sent from the body to the brain, and this either encourages ventilation or decreases ventilatory rate. So the pluses, like for example, external intercostal muscles, if that receptor site is stimulated, it'll cause increase in ventilation. Or you work out really hard, increase ventilation. Central chemoreceptors, CO2 goes up, increased ventilation. Depending on pain, emotions, temperature, depending on what's happening, could be increase or decrease ventilation. Here we got the J receptors, deflation reflex, Hering-Breuer reflex. Deflation J receptors increase ventilatory rate, Hering-Breuer decreases. Irritant increases. Peripheral chemoreceptors, a low O2 or a high hydrogen ion or low pH will stimulate chemoreceptors. So some miscellaneous factors that may influence breathing. Reflex apnea. Sudden painful stimulation, we talked about this earlier, can cause you just to brace yourself, hold your breath. But prolonged painful stimulus causes faster and deeper breathing. And does anyone ever have a baby? You know how they tell you to take deep breaths? Sudden cold stimulation can cause reflex apnea, like dunking in cold water. Stimulation of pharynx or larynx by irritating chemicals or tactile stimulation. Those can cause a reflex apnea, and your body is trying to protect itself. Believe it or not, it's trying to protect itself by doing that. So let's talk about some clinical applications. Now on page 383 in your text, it talks about climbing or increasing altitude, and it goes step by step. So you really need to read this in your text. But it talks about increasing the altitude and how increasing altitude causes a fall in PaO2. Remember, the barometric pressure drops at a higher altitude. So if the barometric pressure drops, then a partial pressure in that barometric pressure is oxygen, and so the oxygen available in the air also drops. Remember, it still stays at 21%, but the amount, the pressure that is available drops, and that's going to have an effect on your peripheral chemoreceptors, and that is going to increase ventilation, will cause a lower than normal CO2, and once again, it talks you right through it step by step in your text. Please look at your textbook. And here's another case study. An unconscious woman was found by her husband, and this is on page 384, and we find out that this woman has a history of diabetes. And one of the risks of diabetes when the blood sugar gets out of control is a diabetic ketoacidosis. And remember, it's an acid. Acids encourage us to breathe more, and so a diabetic ketoacidosis, or DKA, will result in Kussmaul's breathing. And I think Kathy has gone through you with the different types of breathing. Well, the DKA is Kussmaul's, rapid and deep. So what is the body trying to do? The body is trying to get rid of acid. It can't get rid of keto acid quickly, but it can get rid of CO2, which is an acid, quickly. So we'll see crazy things like a pH of 7.0 and a CO2 of 15 and a bicarb of 13, something crazy like that, with the body trying to blow off enough CO2 to make a difference in that pH. So once again, please look in your book. This is a really good case study to read. It's on page 384. And we'll be coming back to that a little bit. And this is a video, Khan Academy, where you can watch that. Now, there is also a clinical connection on page 370 about spinal cord trauma and diaphragmatic paralysis. Now this has an important landmark. Let's talk about that. So injury to the cervical neck can have profound effect on a patient's ability to move and breathe. And the phrenic nerve for each hemodiaphragm, remember that the diaphragm, even though it's one muscle, it's really split in half. So the nerve for each hemodiaphragm emerges from the spinal cord at level C3 through C5. So depending on the degree of involvement, injury to this region of the neck can damage the phrenic nerve and cause incomplete or complete diaphragmatic paralysis. So complete injury above C3 to C5 will result in complete limb and diaphragmatic paralysis. And the way I remember where we worry about the respiratory center, the diaphragm, is C5 to stay alive. I want, if someone has an injury below C5, the chances of them being able to control their own breathing is really good. But if it's above C5, then we're worried about the diaphragm, and if they survive, they will be vent dependent the rest of their life. So, C5 to stay alive. You want to write that down, remember that. But what does it mean? It means that if a spinal cord injury occurs below C5, the chances of the patient being able to control their own breathing and have their diaphragm intact is very high. So here we're talking about the altitude again. Once again, please look at your text. Your text talks you through everything. It talks about why the respiratory rate is increased to a new baseline level when individual who normally resides at sea level ascends a high altitude for 2 weeks, and then why the respiratory rate continues to be higher than normal when the individual returns back to sea level. So we would be considered at sea level. And so going up into the high Rocky Mountains or another really high mountain would be a high altitude. And continuing with the altitude changes, you want to look at the peripheral and central chemoreceptor stimulation, how oxygen peripheral chemoreceptors play an important and overriding role in stimulating increased ventilatory rate at high altitudes. And what did we say happened at high altitudes? Low PO2, low pressure of oxygen. Or how about in a plane? We talked about that in the past. If you're in a plane that depressurizes and all you have is atmospheric air at 30,000 feet, there's not much PO2 in that. And so you're going to start breathing really fast because your PaO2 is going to drop below 60. And how increased respiratory rate at high altitude indirectly recalibrates sensitivity to central chemoreceptors to a lower hydrogen baseline during a 2-week period. So once you've been up at that high altitude for a while, you're going to have a new baseline. Take some time to get back to your old baseline. And once again, the following areas are how central chemoreceptors continue to keep respiratory rate higher than normal after an individual returns to sea level. Make sure, once again, that you're reading your book. Now in case 2, that's the lady who was unconscious with DKA. And this case illustrates how clinical factors other than decreased arterial O2 can stimulate oxygen peripheral chemoreceptors. Once again, look this up. They explain it wonderful in your text. And since a patient had not taken the insulin as prescribed, the ketone acids accumulated, and that caused her pH to fall. And what does that cause? A low pH causes a high hydrogen ion level, and that's going to stimulate those peripheral chemoreceptors and increase that respiratory rate and create that Kussmaul breathing pattern that we discussed. And also, so the peripheral chemoreceptors, once again, is primarily stimulated by oxygen, but can be stimulated by excessive hydrogen concentration. And how this action caused an increase in patients' respiratory rate, that's something you want to consider, reason it out, read it in your book, and how increased respiratory rate compensated for low pH level by decreasing CO2 level, which another source of hydrogen ions. So in Clinical Connection 9.4, we have the hazard of oxygen therapy, and we talked about this already with COPD, the risk of putting someone on a high FiO2. We worry about suppressing um, their drive to breathe, because if they've switched over to hypoxic drive, then the body is now looking for hypoxia to keep breathing going, and not a CO2 level, because a high CO2 level is already out of control, and it stayed out of control for so long, the body switches over to the peripheral chemoreceptors. All right, so Clinical Connection 9-5 shows unusual breathing reflexes. There's the cough reflex, sneeze reflex. By the way, if this doesn't gross you out, droplets may travel 100 miles per hour and up to 12 feet. Once again, please look at this in your text. Now there's the hiccup. That's also another reflex. That's an involuntary contraction of the diaphragm. And it can be caused by, look at all that, it can be caused by almost anything. And what stops it? Well, that's a whole other story. How do you stop the hiccups? There is a drug, but really, I know people who've taken a drug and they're hiccuping for days. I hope none of you have experienced that. We all have experienced the hiccups from time to time, but hopefully they are limited. And we've talked about the mammalian diving reflex, cold water drowning. That's when people stop breathing when they're under cold water. And remember the rule, you're not dead until you're warm and dead. So those people, we can resuscitate them and they might survive, and with minimal brain damage, if any brain damage. Now, I'm not saying that's true for everyone. I mean, there is a limit to what we can do. But cold water, less than 68 degrees Fahrenheit, contracts the face and nose, parasympathetic nervous system is stimulated, breathing stops, heart rate slows, metabolism slows. And that's one of the reasons why you, not only do you stop breathing, but your metabolism slows way down, so you're not consuming oxygen. And because you're not consuming a lot of oxygen, that preserves your brain. All right, so you can read your clinical connection about sneezing. Let's talk about the second wind real quick. So Wes brought this up in class, but phenomenon associated with prolonged exercise, the second wind. So an individual has sudden transition from ill-defined feeling of fatigue, shortness of breath, to more comfortable, less stressful feeling during the athletic event, and oftentimes with strength to press on at or greater than top performance. So that's that second wind phenomenon where a person is actually able to carry on. Now, the stimulus is thought to be associated with lactic acid, and so fine-tuning of O2 supply and tissue cell. Endorphins, so you're on that natural high. And it could be psychological, a good feeling of exceeding what one normally would or could do. So being able to overcome something that you normally would not be able to. And that is the end.